Um, where do I start? um, Over the last 15 years, I've been married almost 16, have a wife and 3 kids. My oldest son is 16, and I have a 11-year-old boy and a 10-year-old girl. My 16-year-old was diagnosed with diabetes at the age of 2. I ended up getting a job with an apartment complex, got great health insurance. My son was a pre-existing condition, diabetes. So he wasn't covered for a year. So we had penicillin, or insulin, test strips, syringes, all this stuff to take care of in the meantime. So luckily at the time we avoided bankruptcy, finding a small government program that we paid $90 a year, and they supplied all the test strips, all the insulin, everything. So we really dodged a bullet then, because we were looking at $400 or $500 a month just in that. And you know, later on, kind of fast forwarding 2001, I was working for MacArthur Center Mall in Norfolk, Virginia, and I was diagnosed with rheumatoid arthritis. You know, over the course of time, we had great health insurance, you know, and when you say that, you know, it's great coverage, but then you start looking at co-pays. And first, we started out, all drugs were $10. Mm. I'm taking almost, you know, up to sometimes 13 different medications a day. My wife was suffering from depression, 4 different medications. My son was on with the insulin and asthma. He's taking 4 different medications. So 21 different, you know, and we'll start multiplying that. And it wasn't bad when it was $200-300, but then they started 15, 30, 50. And most medications end up landing at 30 and 50. And so, you know, it came a time where we were putting out $1,500 a month just in drug co-payments. It was half my salary, you know, and slowly we started losing everything. I mean, we were, you know, typical happy middle-class family. We had, you know, had everything, kids, the dog, everything, and, you know, we, first we gave up the cars, you know, we just have to turn them in. Something we can live with, we'll buy a used beat-up van or something. So I did that, and, you know, then it was the house. We were late 3 or 4 days on rent. We rented a house for 9 years in Kempsville, and house prices, the way they increased, were almost 50%. So they looked for an opportunity, and they took it, and they evicted us, and you know, we couldn't get in anywhere else under $1,300-1,400 a month. I ended up in the hospital with an emergency, with a collapsed lung. I had a infection, and it was from the drugs they were giving me for the rheumatoid arthritis. They're immunosuppressants. You have the chance of coming down with infection. So I had a collapsed lung. I developed rheumatoid lung disease, which is, you know, lesions throughout the lungs. You know, my knees are shot, my ankles are shot, and I was an HVAC technician and control specialist, and, you know, can't do much of that when you can't climb a ladder. So I've been fighting disability for about 2.5 years. Turned me down twice, and you know, we lost everything. We're living with my mother in a 3-bedroom house. We basically converted a garage for us to live in, and it can happen to anybody. And we did everything right, you know.